Welcome, this is Dr. Ala Gad. Today we will discuss a very serious problem that can happen to any healthcare organization that face patients with TB admitted and need to have surgical intervention. As we know, TB is a very serious airborne disease and can infect all healthcare workers, all patients, all visitors if not properly managed. As you know, TB affecting almost 1/3 of the population all over the world, and TB causing deaths of people worldwide more than AIDS, malaria, and other tropical diseases combined together. We know that nowadays we have emergent TB bacillus, we have multi-drug resistant TB, and we have extensively drug resistant TB that cause a lot of resistance to first line medication and second line medication for extensive drug resistant TB. TB, there is a lot of evidence that stated that 2400 BC there is TB infection apparent in Egyptian mummies, and also in Greek Hippocrates advised his colleagues doctors not to treat patients with terminal TB. Actually it was not defined as TB as at that time, but the same clinical picture, and he stated that those patients will definitely die, so it's advisable not to treat, not to try to help them, as long as not to lose the reputation of the physician. TB is airborne infection, can be transmitted through airborne route, and no need to cough or sneeze to transmit TB bacillus from patient to other person. Also, there is another route of TB infection like gastrointestinal tract, but the most common is airborne, as long as the tuberculous bacilli has ability to suspend in air for a long time. So the structure for room to accommodate such patient has to have a different structure. We will see together later on in this presentation, to create what's called negative pressure, not to allow any bacillus to go outside from the patient room to the adjacent rooms or corridors. The natural course of TB, when it's infected to any person, it will go to attack the person, and actually almost 2% of people who got infection will start to have TB symptoms immediately. 5% will have after 1 year, and 5% of the rest will have after 2 years. But the TB will stay in the latent stage of the carrier patient, and can be activated under certain circumstances, like immunocompromised or the patient become older in age. We have to know that immune response through skin test has a lot of fallacy, false negative. So proper intervention, the reading of tuberculosis skin test has to be managed and performed by a competent healthcare professional. Multi-drug resistance TB is a TB that actually start to develop 15 years back, and affecting many patients as a primary or secondary. Primary affection, the source of this infection came from patient already have this multi-drug resistance TB, or secondary, the patient he has a sensitive Mycobacterium tuberculosis, then due to unavailability of tuberculosis medication, the patient start to develop multi-drug resistance TB, and mainly it resists to the first line anti-tuberculosis medication, the INH and rifampicin. For extensively drug resistant TB, actually it can be virtually said it's resistant to second line, and it's mainly affecting healthcare workers, because healthcare workers acquire infection from a lot of sources, different strains. They are very risky environment, and if there is no proper protection and no proper personal protective equipment, I mean N95 mask or respirator, the healthcare workers will place himself in a very big risk. So this extensive drug resistance TB is mainly targeting healthcare workers as a doctor, nurses, or paramedical staff. The patient who are admitted to the hospital with TB, he can be admitted for medical treatment. He need to have control his diabetes, control his blood pressure, or he can be admitted because of surgical intervention or endoscopic procedures, diagnostic or interventional or whatsoever. So we all doesn't know what will happen for the patient as long as the patient every day start to develop something. So we have to be aware and we have to implement the proper infection control measures. As I said, now we have to know where to place this patient pre-operative. We have to place this patient in a place that protect others from getting infection from this patient. It is placed in what's called negative pressure isolation room. This negative pressure isolation room, as you see here, has a private bed, single patient room, private bathroom, has air supply 160 CFM and have exhaust of 210 CFM. That cause what is called negative pressure section in this room. It's better to have what's called monitor here to control or even to monitor the pressure if there is any problem in the pressure of this room. So proper management by communicating the maintenance department or biomedical department in the hospital to avoid spread of Mycobacterium bacillus from the patient room to adjacent corridor or other patient rooms. First of all, before operative procedures, the staff in OR has to review the patient laboratory testing, and they have to make sure the patient do what's called TB culture or AFB, acid fast bacilli. And recently we are depending on PCR for TB that is very fast and can be dependent on the result of PCR, sputum PCR, to know if the patient has active tuberculosis or not. And this is the most fast and mainly it's done for free, funded by many government, in order to make fast and proper diagnosis and identification of the patient for proper management. After reviewing the lab investigation result, we have to make sure of the medication of the patient is receiving, antituberculous medication, and it's better to give antituberculous medication if entitled for the patient before operation with little amount of water to keep the level of antituberculous medication in the patient blood at constant level. This is another type of negative pressure room. This is what's called sputum collection booth. This is to collect sputum for patient, for outpatient, but it's as long as the patient will be admitted, so everything has to be done in his patient room. So the patient has to receive his medication, has to receive his care, has to accept investigations in his negative pressure room designated with HEPA filter and air pressure negative, in order to minimize the patient movement around the hospital, and this movement can cause spreading of TB to other persons. We can depend on the lab result, PCR, to make sure the patient has active bacillus or not. The problem here for the medication, as I said, we have to keep his blood level of antituberculous medication as a constant level, so it's advisable to give the medication before operation if it's scheduled for that time, with a little amount of water before operation. The most important issue for the patient when we will transfer him from his room to the surgical suite, the problem here, we have to cover his nose and mouth, and it's forbidden to ask the patient to wear N95 mask, because it will not be fitted for him and can cause a lot of dissatisfaction for the patient, and the patient even he couldn't accept this kind of mask, but he has to wear a simple surgical mask if he can breathe through it. But all healthcare workers giving care for the patient has to wear N95 mask or N99 or respirator, especially all people working in the operating theater. For the intraoperative management, as I said, all healthcare workers has to wear N95 mask as a respirator in order to protect them as much as we can. All N95 mask has to used according to the fitting test. So healthcare workers has to perform fitting test in order to check if it's valid to be used or not. The patient has to be in operative theater alone, so it's not allowed to have the patient in operative theater doing whatever surgery, and he is confirmed to be active pulmonary tuberculosis, and in his adjacent theater the other patient came for any other elective surgery, because this area all will have suspended air particles of tuberculosis, so it can be a very hazardous risk for the adjacent patient. The problem also for the bacillus, it can be suspended for a long time. Once the patient is discharged, there is a theory to ask healthcare workers to remove the N95 mask and call for the next patient. Actually, no, the patient has to kept in this patient in the theater, and the healthcare workers has to keep the N95 mask, and the head nurse of the OR has to call maintenance department to switch off the AC in order to stop the positive pressure, because the positive pressure will make spreading of air from OR to outside adjacent units. So the AC staff or AC technician has to switch off the negative pressure, and if they can, they have to switch on the reverse action or make it negative pressure in order to minimize spreading from OR to adjacent units. Minimize the healthcare workers that can be accommodated in this room as much as we can, as long as we need to minimize the risk. The problem also is the technical problems to switch off the AC technician from positive pressure to negative pressure. So it's advisable for making a drill and demonstration and regular training for all healthcare professionals, speaking about biomedical staff and maintenance staff, how to manage the HVAC system in order to accommodate such patient under the service of the hospital, especially many unplanned surgery, emergency situation or stat situation can accept TB cases, and they have to do it on the spot in the OR. So the maintenance personnel has to know how to switch off and how to reverse the pressure from positive pressure to negative pressure inside the theater during such airborne isolation procedures. Once we finish the operation, it's advisable not to have post-anesthesia care unit outside the operative theater, or what we call it as a recovery room. We have to recover the patient in the operative theater itself and keep him or keep her in this theater until completely the patient is recovered, and we can transfer to his or her regular room. So the patient will minimize transfer from many rooms will minimize a lot of spreading and a lot of suspicion of transmission of TB from one place to other place. And we have to keep to clean the room as regular cleaning after any surgical procedures, and we have to keep it for 2 hours with no acceptance for any admission of any patient. After those 2 hours, we have to re-clean the area again and wipe all surfaces in order to clean whatever suspended from bacillus that already came from the patient. So we will clean twice. Once the patient is discharged from the OR, we will have regular cleaning after any surgical procedures, then waiting 2 hours, and after that we will wipe all surfaces, high touch surface, and clean every area in the OR as if we would clean from zero. As you know, TB is a very dangerous, very serious, and nobody can protect. How can he protect himself if he is not aware about the proper N95 or N99 mask fitting test, or he is careless in dealing with patient? I am already immune because I received BCG vaccine, or so on. So the patient has to be accepted for medical care or surgical care, and at the same time healthcare workers has to be keen about their safety and their health, so they have to be aware about the proper PPE, and they have to do regular skin test according to hospital policies and infection control standard. It has to be done routinely every year to check any changes for the healthcare workers from negative or from less than 10 millimeters to more than that. And especially if the patient accommodated is confirmed TB cases, all healthcare workers dealing with this patient has to have TB skin test after the patient discharged, and if the patient discharged and we do skin test and it's negative, then after that the healthcare workers start to have symptoms of chest infection and coughing persisting for more than 2 weeks. So we have to do skin test, and we have to do what's called chest x-ray to make sure that the healthcare workers are in safe side, because they can be a mode of transmission of TB for other patient and other healthcare professional. This is the difference between N95 mask and surgical mask. Healthcare workers is the only person who has to wear N95 mask because it has a HEPA filter protecting anything to entering through it to the respiratory system. But patient has to wear surgical mask because this surgical mask is supposed to protect anything spreading from nose or mouth to outside. This mask need training and need competency from the healthcare workers to wear. So healthcare workers are the only person who can wear it. This patient has a chest problem and he couldn't afford to wear this kind of mask. We have to initiate post-exposure prophylaxis after make sure the patient already has positive active tuberculosis. We have to make clinical examination for all healthcare workers who make deal with or make contact with this patient, and we have to examine all of those patients in staff health clinic or occupational health clinic in order to make sure they are free. And we have to do chest radiography if there is problem apparent, or there is skin test more than 10 millimeter diameter. So we need to make sure their chest is clear, and if skin tests are more than 10 millimeter, if we check the chest radiograph and clear, so we can consider it's a local reaction and we consider it as negative result. But the problem here, if we find that one of the patient has acquired TB infection, this patient definitely will be restricted from working as long as this healthcare workers will be transmitted from healthcare worker status to be patient status, and he can pose the organization in a great risk by transmitting this bacillus from him or from her to other colleagues and other patients. So this patient has to be completely away from contacting any healthcare worker or patient until there is clear radiographic evidence or skin test or chest doctor examining this healthcare workers and make sure the patient or now the healthcare workers is free from this pathogen. Thank you.